what is your concept of bactericidal and bacteriostatic? If I say drug A is bactericidal and drug B is bacteriostatic, what is the real difference? Because it's clinically very important to have this concept. Bactericidal and bacteriostatic. Let's suppose drug A is bactericidal and B is bacteriostatic. Of course, every doctor understands, every good doctor knows bactericidal drugs are those antibiotics which kill the bacteria, and bacteriostatic are those drugs which inhibit the further proliferation of bacteria. This is the concept of a good doctor. But some doctors are great. They have a better concept. What is the better concept? Listen carefully. Better concept is that bacteriostatic drug, bactericidal drug can eradicate the bacteria in the presence of ineffective immune system. Listen carefully. When you give penicillins or you give different drugs, you try to disturb the bacteria. Number one, drug may damage the bacteria. Number two, your immune system is also working to eliminate the bacteria. Complete eradication actually requires both things, that antibiotic damage the bacteria and immune system like neutrophils, macrophages, or with the help of complement they can eliminate bacteria. Is that right? Now, it means there are drugs coming and there are host defenses. Now, the difference is bacteriostatic drugs actually just stop the proliferation of bacteria. But elimination of bacteria is done by your own immune system, patient's own immune system. So, it means bacteriostatic drugs can be effective in patients who are immunocompetent. Now, you imagine a person who is immunosuppressed due to any reason. If person is immuno-incompetent or your patient is immunosuppressed and you do a mistake of giving him bacteriostatic drug, what will happen? Bacteria will not proliferate. But very important, but immune system is not functional enough to remove the non-proliferating bacteria. The day you will stop the drug, bacteria will again start their action. This is the problem with bacteriostatic antibiotics. Bacteriostatic antibodies require intact host defenses to eradicate microbes. The real concept about bactericidal is that bactericidal drugs can eliminate or eradicate susceptible microbes even in the absence of effective host defenses. Am I clear? So, of course, now you can understand when you end up with the patients who are very, very immunosuppressed or immunocompromised, you will use bactericidal drugs or bacteriostatic? Bacteriostatic or bactericidal? Bactericidal. You are intelligent, good. So, we should write here a very important statement. Penicillins and cephalosporins are very cidal for susceptible microbes. Am I right? Do you think it's difficult to remember? It's a very simple statement that penicillins and cephalosporins are very cidal or very fatal for susceptible microbes. Not difficult to remember it. Can you remember it all your life? Okay, good. I will ask you a question. Can you tell me the antibiotics other than penicillins and cephalosporins which are also bactericidal? Tell me at least 4 antibiotics other than penicillins and cephalosporins which are bactericidal. Is it important to know or not?
Sure.
Yeah. Can madam? You don't want to tell. She hides her knowledge. You are also same? Who will tell me? Drugs, you are doctors, my friends. Practicing doctors.
Azithromycin?
Aztreonam or what you are saying? Look, my question is, we want to know, look here, we want to know 6 bactericidal antibiotics. 2 I am telling you, penicillin and cephalosporin. Remaining 4 you will tell me. Okay, vancomycin. Very good. Yeah? Rifampicin, no. Yes. We'll talk about that is actually ciprofloxacin. Okay, let me tell you, that is already written on the board. You just find it, it's there. Look, P for penicillins, C for cephalosporins, A for aminoglycosides, V for vancomycin, F for fluoroquinolones, and M for metronidazole. That's so easy. Penicillin and cephalosporin are very cidal for microbes. And you know all the 6 groups. Penicillins, cephalosporins, aminoglycosides, vancomycins, fluoroquinolones and metronidazole, all of them in proper doses are bacteriocidal. Let's have a break now.